Why does asthma make difficult to breathe?
The disease itself, it is leading to tightening of the airways and there is increased buildup of mucus within the lungs. So whenever the airways become tightened, patient finds it difficult to breathe out.
Asthma could speak. What are the warning signs it will give before it becomes serious?
Cough which won't go, nocturnal cough, they are breathless and walking upstairs. Signs which are pointing towards more severe disease are feeling breathless even on rest, having persistent cough, sometimes audible wheeze, can hear musical sounds when the patient is breathing.
Why are asthma cases are increasing nowadays?
Because of there is lot of urbanization, lot of construction activity is going on, lot of pollutants are being released into the environment, lot of vehicular pollution is being created. All of these factors are contributing to the increased incidence of asthma per se.
Can air conditioners triggers asthma?
Air condition definitely can trigger asthma.
Mosquito coils, and most of the people feel uncomfort with the all-out.
All out, not very close. It doesn't cause a significant problem to the patients, but mosquito coil is very dangerous.
What is the biggest myth about inhalers that people need to know?
They will die if they don't use the inhaler. So that is true in the case of severe acute asthma, but if you don't keep the inhaler, you are not going to die.
Is asthma patient has to follow 3 habits daily? What are the 3 habits they need to follow?
If I can summarize, it is follow their prescription medication properly. Second is they can do the subtle exercises. Third habit is
Hi, hello, welcome to Prime TV Health. Myself Bhargavi. Do you get breathless while climbing stairs? Do you have cough that refuses to go away? Does your chest feel tight at night or early in the morning? Most people assume it is because of dust, allergies, atmosphere, or poor fitness. But what if your lungs are telling something serious? Today we are going to talk about asthma, that millions of people affecting nowadays, but still they have so many myths, confusions and fear. So today we have a special guest with us. He is none other than Dr. Syed Taha. Hello doctor, how are you?
hello, I'm fine. How are you?
I'm doing great, thank you for asking. So doctor, what exactly is asthma?
So asthma is an heterogeneous disease. So it causes chronic inflammation of the airways in the lungs. Airways means the tubes which conduct the air into the lungs. They are called airways. So it is a heterogeneous disease. Means the meaning of heterogeneity is it presents differently in different people, and the disease per se doesn't behave the same every time. So it causes chronic airway inflammation and it causes various symptoms like paroxysmal cough, breathlessness, wheeze, chest tightness, etc.
Why does asthma make difficult to breathe?
Asthma, say the disease itself, it is leading to tightening of the airways. So, and there is increased buildup of mucus within the lungs. So whenever the airways become tightened, the patient finds it difficult to breathe out. So that is why they have a sense of breathing difficulty.
Is asthma becoming more common nowadays?
Definitely, asthma is becoming more common than previously. That is attributable to the increased urbanization, lot of construction activity and particulate pollution, vehicular pollution, use of appliances like ACs contributing to the various polluting atmosphere.
Okay. Is asthma a childhood disease, or it can attack at any time or at any age?
Asthma can affect at any age. It is not just a childhood disease. It can affect a person right from the childhood to old age.
Can a healthy and active person develop asthma?
Yeah, even a healthy and active person can develop asthma. Though unhealthy, overweight individuals are more prone to develop the disease. Asthma basically is an immunological disease. It is dependent on many environmental and genetic factors. So even a healthy and active person can develop asthma at any part of their life.
Okay, if asthma could speak, what are the warning signs it will give before it becomes serious?
So initially there will be very subtle signs like a cough which won't go, nocturnal cough, and feeling breathless on doing more than accustomed work. Like they are not breathless when walking the ground, but they are breathless when walking upstairs, like that. So these are the initial subtle signs. But the signs which are pointing towards more severe disease are feeling breathless even on rest, having persistent cough, and sometimes audible wheeze, which you can hear musical sounds when the patient is breathing.
Okay. So you said something about cortical breath. So what is that exactly?
Wheezing is nothing but it is a sound produced when the air is traveling through the narrowed airways, when the windpipe is becoming constricted, so the air will find it difficult to move. So it will create a vibration in the walls of the airways. It will produce a musical kind of sound. Many patients will talk it like cat-like sounds, and few patients will report like gar sound is coming whenever they are breathing. That is called as wheeze.
Okay, what are the earliest symptoms of asthma?
Earliest symptoms may not be very specific to asthma, but these symptoms like a cough which won't go, a cough which is more at night, feeling breathless on doing little more than accustomed activities, these are the earliest symptoms of asthma.
Is waking up breathless at in the morning or night is we can consider that as asthma only?
See, waking up at night has two perspectives. Waking up breathless at night has two perspectives. One, for a known patient of asthma, it is a different perspective. For a patient without known asthma, it is a different perspective. Patient with a known asthma, waking up breathless definitely means that the disease is not in control. And for a normal person who is not previously being diagnosed as asthma, it can be attributed to many other medical illnesses also, like sleep apnea, heart failure, etc.
Why do some people feel chest tightness at night and they never assume it as a asthma?
The common misperception among people regarding chest tightness is one of the common factors which they consider is they think they have acidity. So they will think they are feeling tightness due to acidity, overeating like that. But many a times this will confuse them and it will delay the diagnosis of asthma.
Can asthma exist without wheezing and all?
Asthma can exist without wheezing also. Asthma has certain variants like cough variant asthma, which presents only with cough without any breathlessness and wheeze. So definitely asthma can present without wheezing.
Can asthma cause frequent throat clearing?
Frequent throat clearing means, again, depends on the cause. Patients may be misinterpreting their wheeziness as congestion in the throat, and increased mucus production may lead them to create their throat more frequently. So it is pointing towards the diagnosis of asthma.
Okay, can repeated seasonal coughs? What about the seasonal cough? Is it because of asthma only or it is very natural?
Seasonal cough can be both due to an asthma and without asthma also. Seasonal cough can be due to simple nasal allergy also. It can be due to seasonal viral infections also. But as far as asthma goes, for few people who have seasonal asthma, it is more common in certain seasons like winters or rainy seasons, and very few people even in summers.
बहुत लोग ऐसे होते हैं थोड़ा कॉफ आ गया तो सिरप्स ले लेते हैं उसको पता भी नहीं चलता ये आस्थमा है नहीं तो नॉर्मल कॉफ है इसको डिफरेंस कैसे पता चलेगा ऐसे भी है कई एज ग्रुप्स वाले हैं बड़ा लोग भी जस्ट दे टेक सिरप्स एंड ऑल
Differentiating a normal cough from asthma, it is easy. Don't be ignorant of your symptoms. The disease itself will tell you. If it is a normal post-infective cough or any cough, it will go away in few days, 5 to 7 days. But if it is due to underlying asthma, it won't go away on its own without taking proper treatment. So if it is lingering beyond 1 to 2 weeks, you should definitely consult a specialist and get evaluated.
Why are asthma cases are increasing nowadays?
I told you earlier, it is because of, especially in urban populations, it is due to because of more urbanization, more number of people are coming into the cities. The more the number of people, the more the disease burden. There is a lot of urbanization, lot of construction activity is going on. Lot of particulate pollutants are being released into the environment. Lot of vehicular pollution is being created. So all of these factors are contributing to the increased incidence of asthma per se.
Okay, is there any particular season that most of the people affect asthma?
See, asthma, it has phenotypes. Phenotypes, it presents differently in different people. Asthma is more common in winter seasons. Attacks of asthma are more common in winter season. Because the air is cool and the humidity changes during that time, it can irritate the airways and lead to more incidence of asthma.
Also, you said, can air conditioners triggers asthma?
It's a good question. It's a common question. Air condition definitely can trigger asthma, but if used with very low temperatures, it's in very cool and dry air, it can irritate the airways. And whenever the airways get irritated in people who have a predisposition to asthma, they tend to manifest the disease. So don't keep the temperature very low. You can keep the temperature between 24 to 26 and you should use humidification in the house. Humidity should be maintained between 30 to 50%. so that air is not excessively dry and it doesn't irritate the airways.
Okay. बहुत लोग बोलते हैं एयर फ्रेशनर्स यूज करने से और इवन विद द परफ्यूम्स पीपल आर गेटिंग आस्थमा. इज इट ट्रू और इज जस्ट मिथ?
Perfumes and air fresheners, people won't get asthma per se, but it can lead to an exacerbation or triggering of asthma. Almost 70 to 75% of people with pre-existing asthmas, various studies have shown that they tend to develop an exacerbation of disease when exposed to perfumes and air fresheners. It is because of various volatile hydrocarbons and musks which are used in these perfumes, petroleum products they are used in these perfumes. They tend to irritate the nerve endings of the airways and lead to an asthma attack.
Okay. Can stress triggers asthma?
Extreme uncontrolled stress can trigger asthma in a non-asthmatic. It leads to release of various catecholamine hormones in the body, which in turn can cause airway inflammation and it can lead to more severe asthma attack.
Okay. Does smoking worsen asthma? Because most of the people don't care about their health and they do.
See, tobacco in any form can worsen asthma, not just smoking, even chewing tobacco. Basically, asthma doesn't have a very direct relation with smoking, but people with asthma who smoke, they are prone to develop a combination of diseases. Smokers usually, they suffer from chronic obstructive pulmonary disease. It is a different kind of respiratory disease. It also affects the lung airways, but it is a more severe kind of a disease which is not totally reversible. So, whenever an asthmatic is smoking, so they tend to develop a combination of COPD and asthma. We call it ACOS in medical terminology. So they will have a feature of both and they will not have a totally reversible disease. They will have only partial response to medication.
Okay, what about alcohol? People who consume alcohol.
Alcohol, there is no direct relation, but again, alcoholics, they tend to have, people who overindulge in alcohol, they tend to have aspirations and reflux, acid reflux, which in turn can increase the exacerbations of asthma.
Okay. Most of the people tell, like, I don't know if it is a myth or it is a true, they'll have pets in their home. People tell due to pets, asthma will get, and due to pigeon fur also. So is that really true?
See, animal dander, that is pet and the byproducts of the pet hair, it is one of the major contributors to allergies. Not every person will develop asthma. The patient with a genetic predisposition to allergies and asthma, they will be affected by these furry animals. And as far as pigeons goes, apart from asthma, pigeons and lovebirds, these hobbies, they carry additional risk of a more severe respiratory disease, which we call as hypersensitivity pneumonitis, which causes very severe damage to the lung if it goes unnoticed.
Okay. Except these pets, we have so many things at home that people don't know that specific things triggers asthma. So what are those things at home?
The common things at home which can give to a trigger of asthma is use of incense burning and mosquito coils. Sometimes, especially with females, they may be using washroom cleaners and acids which will create fumes. All these factors, they can contribute to the exacerbation of asthma.
Also, you told about mosquito coils, and most of the people feel uncomfort with the all-out, that one also.
All-out, all these liquids, but all-out if it is kept far, not very close, it doesn't cause a significant problem to the patients. But mosquito coil is very dangerous.
So, if somebody is using all-out all the day, is it really affect their body, or is there any particular time they can keep and they need to wait?
Throughout the day, it's definitely risky, but overnight, it's not a problem.
If we talk about children, what are the common signs in children that we can rectify before getting it serious?
Children and adults, there is not much difference in the symptomatology of asthma. Children also may have a recurrent cough and they may be having, actually children, they cannot express their symptoms properly, so we need to be watchful. So they may be playing less, they may not be going out, they may be spending more time in house. If you ask them particularly, they will say they are getting tired easily. So these are some indirect signs which are pointing towards underlying respiratory disease like asthma.
Is repeated cough in children is normal or it's abnormal?
Children per se, they will have a higher incidence of respiratory viral infections. So like flu virus, adenovirus, rhinovirus, these viruses are more common in children when compared to adults. So just coughing, you cannot say that the child is having asthma. So it may be a respiratory viral infection also.
You're telling about some viruses, right? So can you please briefly explain about it?
See, seasonal respiratory viruses, they are more common throughout the year actually nowadays. So in summers, rhinovirus and adenovirus are common. In winters, all the viruses, adeno, rhino, respiratory syncytial, influenza virus, as well as coronavirus nowadays, it is also under the same domain. So all these viruses are more common in winter seasons. These viruses, normal healthy adults, they may not cause a very severe disease, but people with pre-existing lung disease, people with pre-existing disease like diabetes, people with cardiac ailments, liver diseases, kidney diseases, these viruses can sometimes cause very severe respiratory disease and even require hospitalization.
Okay. Can a frequent chest infection indicate asthma?
Asthma is an allergic disease. Infection is not an allergic disease. Infection is caused by microbes, bacteria and viruses. Asthma is totally different. It can be triggered by a infection. Asthma can be exacerbated by an infection like viral infection, bacterial infection.
Okay. If we talk about diagnosis, how asthma can be diagnosed?
The diagnosis of asthma depends on the constellation of factors like clinical features. When the doctor sees the patient, asks for certain symptoms and examines for certain signs, that is part of the clinical examination. Then they will do some lab test like pulmonary function test, which is commonly used. We call it PFT in short form. It is widely available in the cities. In village areas, it is difficult, but it is widely available in the cities. And other tests nowadays to detect asthma early, we have new tests like impulse oscillometry. It is useful, especially even in children who are less than 3 years, who cannot obey orders, who cannot do a PFT. It is a very objective test. It is based on sound-based technology. So you can just do the test and analyze the airways.
Okay. What exactly is pulmonary function test?
Pulmonary function test is a test where you assess the lungs for various volumes and capacities. You blow into a chamber and it will analyze your respiratory muscle strength in the form of various volumes and capacities. So it is a simple test, but requires trained individuals to do it correctly. So it will give and we use certain parameters like forced expiratory volume in 1 second, forced expiratory volume by forced vital capacity. Initially you will do the test without any medication. Then if it is showing any abnormality, like if the volumes are lesser than 80%, you give a bronchodilator challenge and you repeat the test and see for reversibility.
Okay. Can asthma be detected before severe cough?
Yeah, asthma early diagnosis can be done nowadays. Even in simple PFT, you can pick up early asthma by looking at FEV 25/75 ratio, and using newer technologies like impulse oscillometry, it has become more easier. And people with cough variant asthma, which is a variant of asthma which presents only with cough without any breathlessness or chest tightness or wheeze, you can detect by doing a test known as methacholine challenge test. So these tests can help you pick asthma earlier.
Are scans always necessary?
No, scans are not always necessary for a diagnosis of asthma. Scan will be ordered only when you are suspecting any underlying infection or structural lung disease.
What is the most biggest mistake people do?
Most biggest mistake is ignorance. People may ignore their symptoms. People may use over-the-counter medication. So slowly the disease tends to worsen and it may present more dramatically, requiring hospitalization.
Okay. Is asthma really curable or is just a myth?
Asthma as a disease is not totally curable, but it is a very much treatable disease. The disease can be treated to such an extent that the patient will live a near normal life.
Okay. Why inhalers are considered as a golden treatment?
See, asthma is a disease of the airways. It is affecting the respiratory tubics. Okay. So the treatment inhalers, what it is a device which is developing the medication directly into the airway. You are inhaling it into the lungs. So it is beneficial in such a way you are directly putting the medicine into the point of inflammation. So it is not requiring a longer time. If you take a pill, it has to go into the stomach, it has to get absorbed, it has to metabolize and then reach the lungs for its action. It is going to take a longer time. Whereas inhaler, as you take a puff, it will reach the lungs and start the action. So it is a very fast and it will require a very low dose of the medication.
Okay. Also, if someone is using for long term, is it okay?
Long term, Depends on the severity of the disease. So if their patient has persistent symptoms, they have to use the inhaler regularly. Long-term use of inhaler is not going to cause any harm.
Okay. Because most of the people have fear for using inhalers. So what you want to tell to them?
See, it is a taboo. Oh, so it's a big taboo. It's a misconception among the people that if they are using inhaler, they will say various things like they are in the last stage of the disease, like they will get addicted to the inhaler, they cannot live without inhaler, they will die if they don't have inhaler. It's all dramatic things they say in the movies and they think that it is true. It is not like that. Simple terms, I'll give you an example. If you have diabetes, you are going to take the medication daily. Are you going to call it an addiction? No. Then why are you calling inhaler as addiction? It is a need. It is a medicine. You cannot call it addiction.
So most of the people before consulting doctor, they just go to medical stores and all, and they will take some of the other inhalers which suggested by a medical shop owner. So is that really okay, or we have to consult if there is a small issue? We need to get to doctor, or is it okay to get medicine from medical office?
Self-medication with the help of a pharmacist is not advisable. They lack sufficient knowledge to give prescription-based medicine. They'll give you only symptomatic treatment. So if you first time you may feel better by taking the medicine, but in the long run it will cause you more harm. If the disease goes undiagnosed and untreated, it is going to become worse. So self-medication in any form or from an unauthorized person like a pharmacist, it is always going to harm the patient more.
Okay, can a pregnant woman safely use asthma medicines and all?
Inhalers, they have been approved for use in pregnancy as well. They are very safe. They do because the dose of medicine is very less, and these medicines have been tested even in pregnant females. So they are not known to cause any major effect on the patient or the fetus.
What is the biggest myth about inhalers that people need to know?
Biggest myth I have personally have heard is they will die if they don't use the inhaler. So that is true in the case of an acute attack of asthma, what you call as severe acute asthma. Then they will require repeated use of inhaler or bronchodilator. But if you don't keep the inhaler, you are not going to die.
Okay, what exactly happens when they attack with by asthma in a severe case?
Severe. You are talking about acute severe asthma, I think. Yeah. So severe acute asthma is different from a typical well-controlled asthma. And they will have very severe breathlessness. Like they will be breathless even while sitting. They cannot talk in complete sentences, and they may be having chest indrawings, they may be having cyanosis, and they may be having audible wheeze, and in the most severe form it may cause change in the consciousness of the patient.
Okay, does it affects to heart attack or heart stroke?
It doesn't necessarily affect the heart, but it can lead to rapidly worsening of respiratory failure and respiratory arrest.
What should family members do if someone attacked by asthma or in any emergency case before rushing to hospital?
Yeah. So it will be a panicky situation. So seeing the patient suffer, they will be panicking, and when you panic, you cannot take good decisions. So first of all, don't panic. Nowadays we as doctors, we give a written asthma action plan. We give something to a patient known as written action plan, that what they are supposed to do when they have an exacerbation. So if the patient has it, you try to follow whatever is written in the written asthma action plan. If they don't have it, you can first thing to do is give them repeated nebulizations with the bronchodilators, whatever they are available in the house. Give them repeated nebulizations 2 to 3 times. It will help bring down the symptoms. Then you can take the patient to the hospital. Don't panic and don't get anxious. Be calm, composed, and motivate the patient. They will be in a panic situation. They will become anxious. Anxiety will trigger asthma more. So try to calm the patient. Give them repeated doses of bronchodilator in the form of nebulized therapy, whatever is available in the home. If you don't have a nebulizer, give inhaler with spacer. You can give 2 to puffs for every 5 minutes like that, and observe the patient. If no improvement, please take the patient to the hospital.
Okay. So what lifestyle changes we need to do?
Lifestyle changes, yeah, it's a good question again. So any asthmatic or a patient with a respiratory disease, they can follow various lifestyle changes, like they can take a balanced diet rich in antioxidant foods, which is composed of green leafy vegetables and fruits, and they can do exercises like for asthmatics and respiratory disease patient. We definitely don't recommend very aggressive exercise. It should be a gentle exercise like walking. Swimming is a very good exercise for patient with respiratory disease. So swimming in asthma, it has a moist, humidified air, so they won't get the triggers. So, and they can also do yoga. Definitely, it will help them breathe better.
You said swimming is better, but most of the people think people who have asthma should never go for swimming, or else they will get breathing problem and they think they'll die. That kind of.
That is a wrong perception. Swimming is a good exercise for a patient with asthma. They can definitely go for a swim.
Okay, can a person who have asthma, they can go for cricket, some kind of sports also?
Lot of people already, they are into sports. People living with asthma are into sports. Yeah, but they should. It is possible only when you control your disease well. If your disease is uncontrolled, if you are not using your medication properly, the disease won't permit you to go into sports activity. So if you follow your medication properly, you can definitely go into sports. And many of the sports people, what they do is they use the rescue inhaler half an hour before going in for the sport activity. They can use 1 to 2 puffs of the inhaler and they can do their sports regularly.
Okay. Does diet affect asthma?
Diet per se depends. If the particular patient is allergic to certain dietary components, it may lead to, again, exacerbations. Common being nuts, groundnut and all, they are the common triggers. Certain people will have seafood allergy. So few dietary components can trigger. So if they are getting a thorough evaluation of their allergic condition, if they do a skin test or a blood test for a food and inhalation allergen, we'll get to know which foods to avoid. So food per se doesn't have a very direct relation, but people who are allergic to certain foods, they should be avoided.
Okay, what are the best fruits for asthma patient?
See, colored fruits are always better. So they will have more antioxidant property, and the antioxidant property will lead to decrease in inflammation.
Does vitamin C fruits and all increases the asthma, or it will help for asthma?
There is no direct relation with foods rich in vitamin C. Vitamin C is considered a very good antioxidant, again, as I told you. So foods rich in antioxidant, they will decrease the inflammation in the body, anywhere in the body. So in that way, it is useful.
Okay. So most of the people get hydrated all the time who have asthma. They always feel thirsty. So it is because of asthma, or else if they have any other problem in their body?
Like they may feel more thirsty if they are breathless, because their work of breathing is increasing. They are always breathing against closed airways. So their body is spending more energy on breathing. So whenever the work of breathing is increasing, the airways will dry up and they will feel more thirsty. If they have the disease in control, if they are compliant with their medication, these things usually don't happen.
Okay. What precautions if someone has to take while they're traveling? Most of the people do continuous traveling due to their jobs, or there are many travelers. When they go to heights and all, they feel breathless. Okay, so what things they need to take care of?
Whenever you are traveling, don't forget to carry your inhalers. And then particularly with respect to travel at height, the oxygen concentration in heighted places is lesser than the normal planes. So they should be more careful. Proper acclimatization should be done. If you are going for very high places like Ladakh, Himalayas, so you should have a rest period. You should ascend slowly. You should take breaks. You should allow your body to adapt to that environment.
Is there any particular tablet that they need to carry?
Normally we give one acetazolamide tablet is given. It helps the body to adapt to the conditions more fast.
Is asthma patient has to follow 3 habits daily? What are the 3 habits they need to follow?
The 3 habits which can really help an asthma patient, if I can summarize it, is they have to follow their prescription medication properly. Second is they can do the subtle exercises, as I told you. They can do very moderate exercises. They should not do very aggressive exercise activity. Slow build-up should be there. So they can do basic brisk walking. It helps them. And third habit is avoidance of triggering factors, allergens and tobacco in any form. So these are the habits which will help them change their life.
ओके और एक डाउट है, वुमेन में ज़्यादा आस्थमा इफेक्ट होगा नहीं तो मेन में ज़्यादा आस्थमा इफेक्ट होगा?
As such, not a very clear difference between the both the sexes, but it depends on country to country. Few countries they have female predilection, few countries they may have a male predilection. Males, as they are more outdoor, they may have a slightly higher incidence of asthma.
ओके क्योंकि ना वुमेन ज़्यादा पैनिक हो जाते हैं कई सिचुएशंस में, सो दैट अफेक्ट्स द मोस्ट. और
Panics, it doesn't have a very direct relation to the panic and anxiety. So it is, as I told you, it is more of a allergic inflammatory disease. It depends more on the genetic buildup.
okay, and what is the exact diet if you tell to our viewers to follow this diet in the morning, like breakfast or lunch or dinner, to add something specific food, so what will be that?
Foods with anti-inflammatory properties, they definitely help because it is an inflammatory disease basically. So foods will bring down inflammation, foods which are very balanced, like they should have a portion of green leafies and they should have a portion of colored fruits. So when it is added to our routine diets, it will help us to fight the diseases better. Because many a times asthma is getting triggered by respiratory viral infections, So these patients, if they are vaccinated against these commonly available respiratory viral vaccines, that is influenza and nowadays COVID also. So these vaccines which help, they will help us to bring the incidence of the disease down, and they may mitigate the disease, and they may help the patients with pre-existing lung disease like asthma.
What advanced technologies do hospital use for treating asthma?
Advancements in treatment, you mean to say? So apart from the, say, there are some variants of asthma, like difficult to treat asthma, asthma not responding to inhaler therapy, asthma not responding to steroids. For such patients, newer modalities of treatment have come. One bronchoscopic procedure is there, bronchial thermoplasty. They use special lasers to burn the thickened respiratory tract. So they will bring down the hypertrophied glands in the respiratory tract, and it is helping the patients with advanced and difficult to treat asthma. So it is a treatment option nowadays. It is being done in the corporate hospitals nowadays.
Do you use AI or digital tools in the treatment?
As of now, AI is still evolving, but people have started using AI. It may help the doctors as well as the patients. It can help formulate the action plans. It can make them the life easier for them. They can use an AI assistant with the help of their doctor, which can help them guide in the time of exacerbation.
How do electronic medical care improve a patient condition?
Electronic medical care means, are you talking about telemedicine? Yeah. So telemedicine in remote access areas, tribal areas, village areas where they don't have access to a specialist. So in that way, a specialist can guide the doctors over there or the patient over there remotely sitting in his place. He can guide them definitely what to do, what will be the next appropriate step to treat the particular patient. Because many a times just guidance can help tide over a severe disease condition.
Doctor, what is the difference between other hospitals and Olive Hospital?
Yeah, our hospital, with the vision of our founders, we are more focused on ethical and affordable healthcare. And we have all the qualified specialists available here. And we have a very good team of critical care, pulmonary medicine and internal medicine. So we emphasize on empathy and affordability. So we give utmost care to all the patients. This is a very non-commercial hospital. So in that way, we try to help our patients as much as possible. The diagnostic modalities are same everywhere, but we give that extra empathy to the patients in this hospital. So in that way, we are different.
Doctor, how do you treat emergency cases? Is there any specific team for emergency cases?
Yeah, we have emergency and critical care teams for all the medical ailments. In severe asthma patients, sometimes it can go very bad. Though it is not a reason to panic for all the patients living with asthma. Sometimes the disease becomes so severe that the patient may become unconscious, They may have a respiratory arrest. So they may require even ventilatory care in the hospital. So we have all the emergency and critical care teams here. We take care of our patients, and usually these patients do well. It is in the remote areas and areas without proper access to medical care that it contributes to the mortality. So otherwise, an asthma death is not very common in the city.
Okay. So one more doubt, is any doctor available on call if someone is having an emergency?
Definitely, we are available 24/7. We are there to help and assist our patients at any part of that.
So doctor, the final question is what instruction or what is the thing you want to give to our viewers and also people who are suffering with asthma?
For the viewers, the message today would be, first of all, we should focus more on the preventive aspect of the disease. We should live a good lifestyle. We should have active lifestyle. We should avoid junk foods. We should eat balanced diet. We should, if you are diagnosed with asthma or any other disease per se, please follow the treatment prescribed by your doctor with regular follow-ups, and stick to the medication prescribed by him. Don't self-medicate. Don't take medicines prescribed by non-qualified people. And whenever you feel that the situation is going out of hand, if you are having severe symptoms which are not going away by the routine medication, please visit the hospitals immediately so that you can prevent the complications.
Thank you so much for giving your valuable time, doctor. Thank you so much.
Thank you.